enter the room.
Hello, good evening.
Hey, doctor.
And uh, what would what would you what would you like me to call you?
I'm Hannah. Hannah is fine.
Okay, can you confirm your age for me?
I'm 53, doctor.
Well, Anna, I can see from my notes that uh, you you had a chest pain 1 month back, and you were scheduled for some surgery. Is that so?
Yeah, doctor. Something they said it's angina. Yeah, they said it's an angioplasty surgery. I'm still waiting for that.
Okay. So, uh, can I have a chat with you to know the situation in detail?
Yeah, yeah, sure, doctor.
Yes. So, see, as you have mentioned, you were planned for some surgery. Uh, can you walk me through what happened 1 month back?
I had this sudden chest pain, and it was there for some time, and then afterwards it went off. And when I came to the hospital, they said that I had something called angina, and they said it can become a heart attack. So yeah, that's why they're doing the surgery.
So, okay. So, uh, can you tell me about your diet? What diet you are following?
I eat relatively healthy. I mean, my wife, my husband cooks a lot for me, healthy food, vegetables.
And have you had any other medical conditions? Like,
Um, just cholesterol, doctor. I've been taking this statin tablet for that.
okay, well, so are you allergic to any medications?
No, not really.
Okay, and what about do you drink or smoke?
Yeah, I mean, of course, everyone does.
Hello?
Yeah, I mean, of course, I do. I mean, everyone does.
Yeah, so since how many years you are doing have smoking?
More than like 20 years, doctor. I started in my college.
Well, and how many packets of cigarettes you smoke per day? Like,
Not much, maybe like 2 packets in a day, that's all.
okay. So, mm, so since you are planned for surgery, so
Mm-hmm.
thank you for having the chat with me. So, since you are planned for the surgery, as you have mentioned, since you are planned for the surgery,
Mm-hmm.
uh, I'm and you mentioned to me that you're uh, uh, smoking for a long time.
Mm-hmm.
Uh, and I would strongly recommend you to avoid avoid smoking because it's very important for the surgery.
I mean,
Can you follow me?
yeah, I understand. I mean, even my GP also keeps telling me that thing only. I mean, I don't really want to stop, doctor.
Yes, I can really understand your situation, Anna, because you are smoking for last 20 years and it's very difficult for you to quit this habit. Uh, but since smoking is one of the cause for your condition, like angina, hello,
Yeah, yeah, I can hear you.
and because smoking is a one of the cause which of angina. So
Oh,
even after uh, and it's angina, and so it's very important to stop it. Like it's very essential because it may cause many complication in the future too. Are you following me?
Yeah, I mean, I get it, but my grandfather, he's like 90 years old. You wouldn't believe he smokes like, 60 cigarettes in a day. That's like nothing close to mine. He's happily living. I don't think anything will happen to me.
That's very good to hear that your grandfather is living
Hmm.
happily. But um, but he was not diagnosed with any medical conditions. But now you are having a condition, like you are having a chest pain and you are diagnosed with angina. So,
2 minutes remain.
so it
Okay.
can be like smoking can be the cause for that.
Hmm. Yeah, makes sense. Yeah, I mean, yeah, like you said, I understand. Yeah, it could be causing angina, but I mean, I don't know. Do I really need to stop? I mean, it's something that I enjoy doing. Just that's all
Yeah,
I do with my friends, and
yeah, I can understand that. But as I already mentioned, from our part, it's we strongly recommend you to quit this habit because even after the surgery, you can lead a you can start with a new life, like a new beginning by quitting this habit.
I mean, yeah, I
How
know
this?
it's up to you to say, doctor. I mean, it's something that I really enjoy. What else can I do? How else? How do I?
Yeah, yeah, you can like after even after quitting, you can find other ways, like other ways of enjoying your life. Like you can try many things, many other
Oh,
things.
oh, like what, doctor? I'd love to know if something can actually help.
Like may I know what are your hobbies? Like what all things you do?
Hmm. I mean, I go to pub with my friends. I drink, I smoke. Yeah, that's all. Not much.
Okay, you can like enjoy. Like, you can shift. Maybe you can shift this to what about doing yoga or meditation?
Oh, okay. Yeah, I can try that. Yeah, but I don't know. I mean, I can't really,
Move
I
on to the
can't
next
stop.
station.
Okay.
Nice. That was really good. Yeah, I mean, you tried
Actually,
a lot. I know I was being
no,
rude.
I have not read the book, like surgery cases too. So since there were no volunteers, I just tried.
No, no, that was really good. I mean, for the first try, it's really nice. I was also being a little difficult because that's how
Okay.
patients are in the exam also. Whatever you
Yeah.
tell, whatever you tell, they'll tell the opposite of it. But your performance was, it's good in a way that for a first time because we have a lot of points that we can tell you that will actually guide
Okay.
you because you won't make this mistake again right now. So whatever
Yeah.
we tell you, I'm sure next time you do this kind of case, you'll remember those. I'll just give it to the examiner.
Talk about all the ways that you could have improved upon the station. So
Okay.
initially, when you're actually reading a question, when you're standing outside in that 1.5 minutes, you first try to assess what type of a station it is, so that you could
Okay.
understand that it's a counseling station and it's a lifestyle counseling station, right? Is that something that you understood?
Yes.
Right. So in these counseling stations, your history taking should be very short and to the point. That
Okay.
history that you take, it should actually help you in explaining the management plan. All right. And you asked a lot of good questions for the history. So initially, you know that she came in with chest pain and she's scheduled for angioplasty. So when you started off, you definitely used what was at your disposal. That's very good. That's one way to actually save on time. Because you're already asking her. I can see from my notes that you've you had a condition for which you're scheduled for a surgery here. Could you tell me a little bit more about it? Then she'll go into explaining, yeah, I had the stabbing chest pain and I came to hospital. They did some investigation. They told me it's angina. And so they told me that I have to undergo the surgery. All right, thank you. Are you experiencing any current symptoms? Because any doctor, before you actually, go into anything else, the first thing you have to ask is, are you in pain right now? Are you experiencing any difficulties that I can help you with right away? Right. So the first thing you should ask, are you experiencing any symptoms? Are you having any difficulties? And accordingly, she'll tell you that no, yes, right, and then move on to asking about a little bit about the past medical history, because ultimately you have to talk about smoking, right? So you think about everything in the PMAFTOSA that can help you in telling the diagnosis better, help you understand the general state of condition of this patient. So past medical history is important. You need to know what medical history, what condition she already has, that smoking can eventually worsen also, right? Or that could have contributed to the angina itself. So the past medical history is important. The medication is important, whether she's compliant, whether she's taking it well. The food that she eats is very important again, because that is a contributor for why she could be having hypercholesterolemia, or why she had the angina. A little bit about the hobbies. That's good. That should have come a little earlier, but not bad you asked about it. So a little bit about the hobbies as well, so that you can incorporate that in your management, right? You wanted to incorporate, but you didn't know, you didn't ask. That's why you're actually asking those questions, so that you can incorporate it in your management. And yeah, mostly all these things. And how is life, I mean, who lives with you, a little bit about lifestyle, but keep it short, like to the point. And then immediately go on to the smoking history. But when you're talking about the smoking history, you have to always signpost. That's one thing you left out from, because it's a kind of difficult, uncomfortable topic that someone would be transitioning into. So when you're transitioning into that, you have to give them a warning shot. Tell them, signpost, saying that I would like to ask you a little bit in detail
Yeah.
about your personal life, if that's all right. And then if they give you the permission, at least they know that it's going to be something uncomfortable, right? They'll be
Mm.
prepared for that question. So yeah, do you smoke? How much do you smoke? And the smoking history that you're taking is again tailored to what you have to say in management. So you're asking if you smoke, that's something that you already know. How much you
Okay.
smoke, all right. And how often, that's all right. Yes, good performance, Dr.
Yes.
Tulya. Right. Then I'm sorry, I just lost my chain of thoughts. Okay, so how much you smoke, but the next thing you have to ask is, have you ever tried quitting? Like if you need to
Okay.
understand all the methods that they have already tried, so that you can avoid those, or you can say something, that is not that, right? Like, have you ever tried quitting? And she's like, no, no, I enjoy it so much. They're like, what exactly about smoking do you enjoy? That's also an interesting question, because you can give therapy tailored to what exactly they enjoy about it. Because if it's the
Okay.
high that they like, you can give nicotine replacement therapy, or also redirect their enjoyment into yoga or other activities. If it's the oral fixation that they like, then you can always tell them to try an alternative of e-cigarettes, which is relatively less harmful, or chewing gums, right? If
Okay.
it's a social group that they like so much, then you can always redirect them into a focus group that can help with inspiring stories of people who have, quit smoking, right?
Okay.
So that's what, no, your data gathering is tailored to what you need to talk to them, because this is a person who's been smoking for a very long time. Okay, that's another important question, like for how long have you been smoking? So they've already heard this. He's also said things like, my GP told me that smoking is harmful, but that's something that everybody tells, right? So they've already heard all that. So many people have already told them. So how would you better explain it to them? It should be tailored to their lifestyle, how they can incorporate it in their livelihood. The changes that they have to make. So apart from this, so that's one aspect that you could have asked. And now moving on to the management bit. So first of all, this person is having a lot of misconceptions that you can understand, because she thinks that she's fit and fine because her 90-year-old grandfather is fit and fine, right? She thinks there's nothing that will happen to her, right? It's just I mean, smoking is what everybody does, right? She
Okay.
doesn't understand what the setting of this person is. She is so inclined to smoking that become such a part of her lifestyle. She is definitely going to go back and smoke after this surgery, right? So she doesn't understand the implications of how badly it will affect her life. But she came in with the chest pain, which was stabbing and painful. So that entire experience for her was painful. So you have to leverage that bad experience to actually convince her not to smoke. So then you have to bring in the relation. So what you need to correlate for this patient is that you see you have hyperlipidemia, you have a history of smoking, and you've had this attack. Now people who have this attack are at a higher risk than everybody else of having it again. So your grandfather, who's 90 and still smoke, he's never had the attack. Even though he's 90, he's at a lower risk than you are. And if you continue smoking, the probability of you having another attack is very likely and very soon also. And this is also something that's going to affect your surgery. When you won't be, your recovery from the surgery will also be hampered. The surgery itself will also be hampered. So these are the ways smoking can affect your life. Telling them all this will actually, something will strike them, some point of their aspect or of their misconception will strike them, for which they will agree to what you have to say, right? So that when you're saying the diagnosis bit, this is the correlation that you have to bring. Instead of diagnosis, this is like a proxy for that. So bring about the correlation of how harmful smoking can be to the current condition this patient has, right? So if you see in management, the first thing is explain the correlation of the recent angina and other conditions like high cholesterol and smoking. Yeah. And explain a little bit about the procedure that this is, I mean, if you have time, but mainly you're talking about smoking, right? I mean, if you'd asked her that, has anybody explained to you about the procedure, she would have most likely said, yeah, I know everything about the procedure, because your topic task is actually to go explain and talk to the patient about lifestyle changes and cessation of smoking. So after that, the main thing about this is usually in UK, whenever a patient comes with a need for cessation of smoking, they are referred to smoking cessation clinic. So that is one important point, that if you're actually starting to prepare, that it'll be yeah, you might not know this, but this is one place that people send them to, they refer them to. So they actually give them psychological help, they aid them with medications to stop smoking and all that, right? And then from what you have understood from the aspects of why this person likes smoking, according to that you can give the tailored management plan. So there are many methods with which we can help you in quitting smoking. There are nicotine replacement therapy that will, by using something like this, you can experience the same kind of high that you feel from smoking, and slowly you can wean it off. You can also redirect your energy into playing yoga or other activities that you enjoy doing. But if it's the oral fixation, you can say that we can offer you some gums, and can also try out some less harmful alternative like e-cigarettes, right? And if it's a social group, we would like to introduce you to certain focus groups that focus on ways to quit smoking, and reformers who come and give inspiring speeches about how quitting smoking has improved and changed their life, right? So then they have options. Now it's upon them, so you're giving them the autonomy to actually choose whether or not they want to go forward with this, right? So, yes. So now 2 minute bell, the one thing that we always try to emphasize upon, as soon as you hear the 2 minute bell, start wrapping up your station. So try to at least hit upon the points of safety netting, follow up leaflets and pamphlets. So safety netting, we can always say that if your symptoms worsen, because she's already had an attack. So any worsening of symptoms, if you experience, please come to the hospital immediately, or call the emergency number. Um, um, if safety netting, you can that is for safety netting. Follow up within a few weeks with your GP on any change in medications or any other ways that they can help you with smoking cessation, and leaflets and pamphlets finally, to explain to them, for helping them understand how to quit smoking and implement reform measures in their life. Yeah. So let's take a look at the signposting. I mean, IPS as well. IPS greeting, that's great. Empathy. So empathy, that's important because you're talking to a patient who has undergone a serious medical condition and she's getting ready for surgery. So when you hear that she's had this, incident with the angina, the pain, I'm so sorry. Just follow that up with, I'm
Okay.
so sorry. You are to undergo that. I know it must be a little difficult. Just empathize with them so that they feel like they want to talk to you, right?
Okay.
And it's nice you didn't use any medical jargons, and that's great. A final autonomy, yeah, you said it's ultimately your decision. Yeah, yeah, I highly encourage you. That's very good. Yeah, but if you had given more plans of how you could have reformed it, that
Hmm.
would be like complete autonomy. Like what they
Okay.
want to choose, when they want to choose, right? And signposting, yeah, that's also something that is important, especially when you're transitioning from one, a conversation to, to maintain the flow of conversation, especially when you're bringing up something uncomfortable. Yeah, and you were not judgmental. That's good. Ice is very good. Do you know what will happen if you continue smoking? That's an important question you could have asked.
Okay.
Yeah. And since you are at position where you're explaining it to them, any questions they have anytime, you should just listen to them. Maybe like, because you're trying to give them as much information, or change any misconceptions that they already have, right? So
Okay.
that was also done very well. Just a few here and there. Sometimes you were trying to talk and the patient was also trying to talk at the same time. But yeah, that was actually, that was well done itself. All right, Dr. Atulya, I hope this was helpful for you and
Yes,
everybody who
very.
joined today.
Yeah,
So
it's very
next time,
helpful. So I'm like I just started the preparation, so okay, it was good because I just gave away model session, so it was very good for me. Team
that's
bro.
That's great. That's great to hear. I mean, that's what we are trying to tackle all the difficult cases. I mean, even though it seems easy, a lot of people end up losing time in data gathering, especially in such stations, because we have so much to
Yes.
talk about in management. So we're trying to compile all these difficult cases and try to present it on this forum. So thank you for participating. I know it's
Thank you.
difficult to start off right at the beginning, but that was great.
Thank
And we
you.
hope to see you more often, actually. You can fill in the form, you can ask for a date again. We really appreciate people who have already joined with us to take more tries so that we
Yeah.
can even introduce you to more stations like this, the topics, overall
Yes.
topics.